First, we can talk about Baker. We went over Baker Mayfield's injuries before, earlier in the season. We know he has a torn labrum on his non-throwing shoulder. It's something that's going to need off-season surgery. The hope was that he could keep playing through it if he doesn't continue to dislocate. And we haven't seen him dislocate since. So I think that's, a hopeful sign. It can happen anytime. Baker, has reported quite a few injuries. The knee one, I'm sure, was scary for him. There's a nerve that travels down the side of the knee, and sometimes it's injured when you have a scope. And if you hit that nerve, it could feel like the bone has just broken in half. It's just a searing, terrible pain. And it sounds like he got trauma right to the nerve. So I think that's something that's been affecting him. I'm not sure about the heel bruise, how long that's been going on, but they're in a bye week. So the hope is he can return and sort of be able to pull it together and be productive for the rest of the season. Jack Conklin had a right patellar tendon rupture. Basically, the patellar tendon is the rope that attaches the quads to the leg. So it's the thing that allows you to straighten your knee and obviously run and jump and all that good stuff. When this thing snaps, the athlete knows it. The kneecap kind of flies north. So you can see this kneecap is a little higher than it should be. And you can see this unraveled patellar tendon that was under tension. It's a really devastating injury. I think it's better than it used to be as far as guys coming back. But it probably is one of those ones that ends the most careers. The rate of guys not being able to come back is about 50%. Some do it, some beat the odds and play great. I think bigger guys have a harder time just because there's more force on that tendon. If there is a good recovery, their level of play afterwards can be affected. And again, it's just a really painful, really difficult and frustrating recovery for athletes to go through. And it lasts about 6 to 10 months, but it can really last years for a lot of athletes. And then finally, Dalvin Cook. I threw these images up. If you've heard me talk about Baker Mayfield before, I use the analogy of the shoulder joint is kind of like a golf ball on a golf tee, the golf tee being the socket of the joint. So you need this cone, this like extra apron around that golf tee called the labrum. And I kind of tried to draw it in here pathetically in green, just to give you an idea of what a labrum is. So basically, anytime you have an athlete go down like Dalvin Cook, I was worried. I couldn't really tell from the video what happened. He was grabbing at his ribs. I thought maybe it was a rib injury. Obviously had a big crowd around him as he left the field, but it sounds like he dislocated his shoulder. Anytime that happens, the labrum tears because that's what's holding the shoulder together. So it sounds like he's actually dealing with a labrum tear on the other shoulder as well. So I would expect that he might miss a game or two, just trying to quiet this down so he can be more effective. He's going to be limited afterwards. Usually these guys will go in a harness afterwards that'll just prevent them from reaching straight up and putting the shoulder in a vulnerable position. And then, depending on how he does, he may or may not want or need off-season surgery to repair it.